Hello, homies, and a very warm welcome to Homeopathy Hangout. Today, we get to hang out with Dr. Loretta Ferrucci in South Africa. Welcome to the show.
Hi, thank you so much. Lovely to be here. And thank you so much for having me.
It's a pleasure. I should have said goeiedag.
Yeah, goeiemorgen.
Goeie-
It's still morning here.
Okay, we're evening here. Well, it's so lovely to have you on. Actually, I think it was through a Facebook post. I saw something, I don't know, was the South African Homeopathic Association or something along those
Yes.
lines? They had a meeting or something, and then I commented on there and I'm like, definitely need to chat with you guys. Please, can I talk to someone? Because I have had Kyle Wilson on the show from the Khula Natural Health Clinic. It must be a couple of years ago now. It feels like it was a while ago. And from memory, I think this post that I saw on Facebook was something along the lines of you needing more funds for Kula. So I thought, let's get you on and just tell the world a little bit about maybe firstly your background of how you found homeopathy and your qualifications, because it is a little bit different in South Africa. And then we'll go on to Khula Natural Health Center, what it is and how people can help and what you do there.
Sure. My journey with homeopathy started when I was 3. I had petit mal type seizures that no one could diagnose or cure. So my parents had me to neurologists and eventually my mother, who was an Afrikaner, a conservative. Anyone who knows South Africans, the sort of Afrikaans kind of church in South Africa is very conservative. It's like the Anglican church, I suppose. So she was this conservative school teacher, Afrikaner, but she was always very into alternatives. And someone said to her, take the child to a homeopath, which she did. And then I didn't have seizures again. So that was my journey with homeopathy. My mother was sold. My father, not so much. My father was, let's just take the drugs. My mother was, let's not take the drugs. So I think I had a nice balance. And then it came time to go to university. I didn't really know what to do. And in fact, I went to study chiropractic because the courses run concurrently at the university, at the Durban University of Technology. So for the first 2 years, because it's just basic science, the whole group is together and then the cohort starts splitting in third year. And so I was going to be a chiropractor. And then at the end of my first year, I was like, no, you know what, backs and necks and sports injuries and stuff, not really my jam. I think I'm changing to homeopathy. My father was like, that's that weird medicine, but bless him, he continued to pay for my education and was quite proud of me and helped me set up a practice. So I was in practice for about 29 years. In fact, I was in the first class when they started the homeopathy course in South Africa. So we were the pioneers, we were the guinea pigs. Yeah, because so in South Africa, homeopathy is regulated and our registers were closed, I think in 1974. And so they reopened those registers to students because when they started the course, in South Africa at the Durban University of Technology in 1989. So that was the first year that it started. Anyway, so 29 years of private practice. And then I got involved with this NPO called Khula Natural Health Center, which was started by Dr. Nicoline Potgieter-Steiner and her husband, Dr. Manuel Steiner. So they were living in Switzerland at the time. Dr. Manuel is a Swiss national. And Nicoline was living there as well, and they were lecturing, and he was working at an anthroposophical hospital. He was also a homeopath. And they
That's
had
handy with a surname like Steiner.
Yeah, absolutely. They were involved in a project in Malawi. And I forget exactly how, but somehow they got involved at Kula Village, which is outside St. Lucia in KwaZulu-Natal, province of South Africa. And the Induna, the sort of tribal chief, they asked him if they could run a trial project there. It's just run the clinic for 2 weeks to see what would happen. And it was such a success that he asked them to try and make it permanent. So that was the beginning of the Khula Natural Health Center. And then in time goes now, pre-COVID, sort of 2018 or 2019, I approached them wanting to open a sort of satellite branch in the province where I live. So I live in the Eastern Cape. And it's one of the poorest provinces in South Africa. We have a massive rural population, very poor access to healthcare. And so I joined the board of Khula Natural Health Center, South Africa, as one of the directors, and then proceeded to start this particular branch. It took about 5 years to get it off the ground because there's lots of politics. And then we had COVID, so we had lockdowns. And anyway, it's been running for a year now. We had our first birthday on the 4th of September this year.
Ah, the clinic that I now run here in Perth, it used to be run by a South African chiropractor, and she also trained in the Durban Institute of Technology and said that she trained alongside the homeopaths, and the one branch would always try and steal the other branch to come across. But I
It was
have a
very
lot of
competitive.
yeah, she did say that. I have a lot of respect for chiropractors, and yeah, I love working alongside them as well. But no, just quietly between you and me, you definitely chose the right pathway.
Absolutely. I've still got friends who are chiropractors from those days, and
Yeah.
and I've been their patients. And I'm like, this is wonderful, but
Mm.
not for me.
Yeah, with everything has its place, right? Like I can't imagine not having a chiro to go to sort out my back, which always having issues with. So when did you say that Khula Natural Health Center started? Did you say
It started
2018?
in Khula village
Mm,
outside St. Lucia, which
mm,
is in central KwaZulu. Actually, it's on the coast, eh? So it's right,
mm.
it's on the east coast of South Africa, halfway up the coastline of KwaZulu-Natal, in the direction of Mozambique, for those people who don't know. So it's in that sort of tropical climate. It's really warm, lots of palm tree, beautiful beach, really nice place to have a clinic. And Khula village is the sort of traditional village that is outside the
Oh, okay.
town of St. Lucia. And that's where it started. So its location is actually great because that Khula, I'm just going to call it Khula SA, right? So we know
Mm,
who we're talking about, right? So Khula or KZN, Khula KZN, because it's been running for so long also, and they started at 1 week a month
mm.
for the first year. Then they moved to 2 weeks a month. And eventually, I think it was the beginning of this year, they've now opened 4 weeks. So they're a full-time running facility. And they have had a total of, I've got it written down here because I keep on forgetting, 45,505 patient visits.
Wow. And it's not
It's a
just
lot.
homeopaths, right? Like it's different. Is it, are there any
No,
traditional?
it's a purely homeopathic
Are you
clinic. So it's pure
serious?
only homeopathy. Yeah. Only because from an infrastructure point of view, it's size. So size is a limitation. Also, there's language restrictions. So not all homeopaths who qualify speak whatever the indigenous language is of the area.
Mm.
Translators are employed from the village. So you need a doctor, you need a translator if the doctor doesn't speak Zulu. The translating is actually quite labor intensive. So the translator can't do it for 8 hours. So you basically need 2 in a day. So all of that stuff, those human resources, you could limit it by how much you can do based on what it costs you to run it. And also one of the other reasons is because I'm going to start by homeopaths, and homeopathic medicine is relatively cheap. So it's not as if we're like, sorry, but we don't want any other CAMS professions. Not at all. That's not the case at all. But our constraints are space and money. And especially for other professions like phytotherapists, for example, costs of medication. Because some herbal medication, like herbal tinctures and those kind of things, they carry a higher cost than homeopathic medicine. So homeopathy is the ideal vehicle for this. And our hope is to expand and to have a number of these centers throughout South Africa and have various CAMS professions. So I said with it all, at least provide a blueprint for other CAMS professions to also actually come to the party.
I hope there's really good record keeping because this sounds like something that could be like really great if it was published, if the results were published. Have you got it all recorded or?
Yes, actually, we have our records are kept electronically. So there are no paper records because paper's a problem. And so we've got electronic record keeping and things like, the diagnoses, the ages, the genders, the statistical data of what kind of conditions are seen, how many people improve, don't improve, that kind of thing. That is all actually recorded. And in fact, there is, I don't know if I'm allowed to say, but I think I can. One of our directors is associated with the university and is arranging to have this data published in, I think, if I remember correctly, we're going per condition.
That
So,
would be
yeah,
amazing.
there's a lot of information that is being amassed that way.
And you're probably seeing lots of like infections and skin stuff and all sorts. So I'm hoping you've got lots of photos as well. Like I feel like a good before and after photo. I've got a really good eczema one on my socials and a really good keloid scar one I posted yesterday. And you always just see like the reach for those ones going through the roof because picture paints 1,000 words. And in Africa, especially with these people that can't afford all these medications, I'm going to guess that you see a lot of infections and wounds and skin stuff and all that sort of thing.
Yeah, so Khula's primary sort of niche, if I was going to call it a niche, is specifically women and children in rural areas, because in South Africa, we have lots of migrant labor. So people migrate, the sort of moms and dads migrate from the rural areas to the cities to work. And the little children are often left to be reared by the grandparents. So in many rural areas, the bulk of the population, generally, there's a large age population in many of the rural areas. But of course, we treat anyone, right? So we don't not restricted to women and children. But because a lot of our patients are geriatrics, we have a lot of the sort of chronic kind of lifestyle disease, diabetes and hypertension. We see a lot of inflammatory
Arthritis.
joint diseases.
Mm.
Yeah, see a lot of arthritis and those kind of things, but we also see a lot of respiratory infections. We do see quite a lot of skin conditions, and then with the very young, we see a lot of infections. We see the ear, nose, and throat kind of things, and fevers, and viral and bacterial infections, and then everything else in between. Lots of stroke rehab kind of patients. When I say lots of, now comparatively, not as nearly as many as the joint complaints, but post-stroke, I think it's also because the care facilities or rehab facilities for those kind of patients, they're very difficult to come by and they're very difficult for them to get to. So yeah, but it really falls, what we're seeing at Khula's really aligns with the statistical data for the country in terms of the most prominently treated conditions in public health as well.
Mm. And how many homeopaths do you have working there? And is it voluntary or do you get paid, or like who runs this?
Yeah. Okay, so let me just give you a bit of history. So Dr. Nicoline Steiner, I'm shortening the story a lot, and I'm probably going to leave a few things out. So
Okay,
don't
we've got
quote
lots
me
of
on
time.
it.
Take your time.
So Nicoline went back to Switzerland and said, there's this opportunity. Can we get a funder? And it was either a patient who had a trust fund or a patient knew a person. It was one of those, not what you know, it's who you know. And so the Khula Foundation was established in Switzerland. And so a large bulk of the money to actually start Khula was foreign funded. And a lot of that money still comes from Switzerland, but there are also South African funders now. So the Oppenheimer Foundation is also one of the major funders. And then there's some sort of smaller funders. So when I wanted to start, there was only one. There was the Khula in KZN. And so when I approached them and said, look, I actually want to start a community clinic, very much like yours, but I don't want to go to the trouble of having to register an MPO. It takes about 2 years. It's really admin intensive, and admin is really not my strong suit. So they said, sure, because I knew them. And they were like, sure. But the deal was that Khula Foundation wanted it to operate completely separately. So basically, Loretta, you can use our MPO, so you can use our registration, but you need to fund it and look after it and do it yourself with our support, but not as part of, if that makes sense. And the impression that I got was, of course, that there was a limited budget. They were funding a project that was working. I know that in Africa, funding projects can sometimes be dicey, right? So yeah, because
Never
the money
quite
very
know where
often,
the one is going to go. Yeah.
never quite know where the money's going to go. So I said, okay, fine. So I'm one of those rather apologize and ask for permission kind of people. And when it comes to things like, no, we don't need that much money to start. We just need to start it, because without the project, you don't have proof that it's happening. No one actually wants to fund you. So with the help of the Homeopathic Association of South Africa, they gave us a small donation, and a couple of other people donated some money. I think we probably had about 50,000 rand, 60,000 rand. So divided by 12.
Yeah, that's about
That will
like,
give you the Aussie dollar.
yeah, yeah.
About 5,000 Aussie dollars. I was like, okay, this should be enough. All I have to do is find a village that has a building, because that was really important. And then I found a village. It was a long story about how I found a village. It took me a long time, but I found a village, and they had a building, but it was really terrible. I put an appeal on my social media page, and someone commented and said, and I recognized the surname, and said, you should speak to Gary. And I was like, I wonder, and I had a patient by the name of Gary with that surname. I was like, I wonder if this is his wife. So I messaged her and I said to her, are you Gary's wife? And she said, yes, get a hold of him. He's a manager of a hardware store. See if they won't donate some stuff. So I emailed him and I said, hey, Gary, and we had a great relationship. And he was he was one of those patients who never took any of my advice, never did anything I said, but came and saw me periodically when he was desperate. Those, right?
Yeah, I've got a few of those.
Yeah, those, right? And I sent him an email and said, look, do you think you could schmooze your area manager or something? This is what we need. And he was like, lucky for you, I am the area manager. And they donated almost all the materials to revamp the building. So in excess of 100,000 rands worth. So without their generosity, we wouldn't have been able to actually have the infrastructure, because it was essentially 4 garages, and we had to change the roof, and we had to put in internal walls and windows and all sorts of things. So that's how we started. And then we also got a substantial donation from a family trust that was associated with the homeopath. And that's how the money trickled in for our startup. And then a friend of mine who was involved with doTERRA, the essential oil company, they have a sort of social awareness arm called Healing Hands. I think it's called Healing Hands. And they have projects where you can, they will only do money for infrastructure, but if you apply and your project gets it, then you can apply for a certain amount of money that you require, and they will match whatever you collect. So you run a funding campaign of your own, And whatever you collect, they will match up to whatever the max is that you put in. And so that's what we did. So then we managed to double our money that way, which was great. And then we started. And the reason why you would have seen the post for the appeal, it was specifically for funding for Khula EC. Because since then, now that the project is running, right, now we are actually part of Khula SA, but we fall outside of the budgetary time. So this was like, okay, we're not quite in the budget yet, but we need some money to run. So we were on the outside, now we're edging onto the inside, but we still need our own funding for the next couple months at least. That's the story.
Amazing. Wow. You sound like a real go-getter. I love your attitude. And I'm a huge fan of, yeah, it's better to ask for forgiveness than, or what's the word? Ask for forgiveness rather than permission or something like that.
Permission. Yeah. Mine was, I apologize. I'm so sorry I didn't ask for permission.
I love that saying motivation follows action. And sometimes you actually just need to do the action, just get that momentum going, and then the magic starts happening. And especially if you come from a heart space and you are doing it for the greater good of humanity, I do feel like there's some cosmic / universal / God or whatever you want to call it, help that comes in and moves the project along. And it certainly sounds like you've been held and had some lovely synchronicities by the sound of it that's happened to help create this. How many homeopaths have you got there at EC?
I run it and I don't work in it as the homeopath. So we've got 2 young homeopaths. When I say young, one is 30 and I think they might both be 30. One qualified when she was slightly older. So both of them have been in practice for 2 or 3 years. One of the aims that we have at Khula, not just Khula EC, Khula National, is to provide employment for new graduates, because it's very difficult for new graduates because homeopathy is not part of the public healthcare system in South Africa. They can't just slot into getting a job in a clinic or in a hospital. So most homeopaths who qualify have to go into private practice, and they just don't have the financial capacity actually to do that. So we lose a lot of our young graduates to industry. Actually, they go and work in industry, or they go and work as medical reps, or they work as a part-time assistant / health provider in a chain store. And so they go to university for 6 years, and then they end up not doing what they qualify to do and what they'd love to do, because they just don't get a foot in the door. At Khula KZN, I think they've got 5 full-time homeopaths. So they work there, and that's their job. They live in St. Lucia or in Khula Village. And then they also have volunteers. So practitioners can volunteer and come for a week, or however long they want to actually. And Khula KZN also serves as an internship site for homeopathic students, because it's about 2.5 hours away by car from Durban. And Durban is one of the universities that offers homeopathy. The other one's in Johannesburg. Khula KZN gets fewer of the UJ students, but many, in fact, almost all of the interns, because the interns, part of the internship is they need to have a certain case number that they have to fill. And it's very difficult for them to do that at the university clinics, because you've got 4th-year students and 5th-year students that all need patients. And so they go to Khula, and within a couple of weeks they get there. I think they've got to get 80 patients or something like that. It's easy to do in a community clinic because you can see 15 or 20 people a day, actually, because there are usually a lot of people. At Khula EC, as I said, we've got 2. And then earlier this year, a 3rd branch of Khula opened in Limpopo province. So a young doctor, her first name is Karabo, I forget her surname. She was a volunteer at Khula. And she wanted to go back she comes from a rural area in Limpopo, and she wanted to go back to her rural village and open a practice. And in fact, she did do that, but she was supplementing her income by working part-time at Khula as a sort of a contract worker. And because she's so dynamic, and because she's so committed, and because it's difficult for her. So we've got private health insurance in South Africa, and there are a fair number of middle income people who have health insurance, and health insurance does actually cover homeopathy, a lot of it, the private health insurance. But for people in rural areas, that's not really an option. And so her clinic her model is slightly different to Khula KZN and Khula EC. She sees these patients privately, and Khula subsidizes part of the cost for her. So it's more like a private practitioner model, shall we say. And then we've got the Khula KZN and Khula EC, which are the sort of clinic models. Khula EC is open only 1 week a month, because we see many chronic conditions. 1 week a month is actually enough for us to see the patients and then follow them up regularly. So we're basically there almost every 3 weeks, right? Because if you come on Friday, on the week that we work. 3 weeks later, we're there on the next Monday. So it enables us to follow up and track our chronic patients, and also people who come in with acutes on sort of Monday. We can recheck them on Thursday and Friday to see if they're heading in the right direction, and then change their medication or supplement their medication. So we're only open 1 week a month. One of our doctors comes from a place called Matatiel. It's about 600 kilometers away from East London. Necha village is where the clinic is. So she treks in a bus. She gets in a bus 1 week a month, and she hires herself down here. We put her up, and she works for the week, and then she goes back. And our other practitioner is local. He lives in East London itself, which is the town that is closest to the village.
That's an amazing commitment. And how cool that you can claim on your private health insurance, because we used to have that in Australia, but then on the 1st of April 2019, the government took that away.
Mm.
I'll never forget, because it was on April Fool's Day, and I just feel that was such a
Oh,
slap in the face. They removed
absolutely.
something like 17 different natural health therapies from the health insurance. And the worst of all is that none of us we didn't get a discount on our health insurance. So even though they took all of these services away that we couldn't claim for anymore, we didn't get a
Yeah.
discount. It still stayed the
Okay,
same
yeah.
cost. So
Yeah, they do pay in South Africa, but the tariff rate is fairly poor. It is better than nothing. And for many people, it comes out of the saving component of their health insurance. So there's not a specific component for homeopathy and chiropractic. So for example, all CAMS medicine comes out of the savings component. And the savings component is not huge, but it is better than nothing.
and
It
a
is
slap in the
something.
face.
It's better than a slap in the face. Yeah.
So, how can our listeners, we've got listeners from around the world. Actually, our biggest listenership is in America, followed by Australia, and then UK and Canada and New Zealand. How can we help? How can the listeners help?
We obviously have social media pages. So there is a Khula Natural Health Center, which is the KZN one's social media page, Facebook and Instagram. We have one for Khula EC as well, Facebook and Instagram. Obviously, if people are able to donate, we would be ever so grateful for that. In South Africa, we have a funding platform called Back a Buddy. And we have Back a Buddy links. So you can go onto a Back a Buddy platform, and you can pledge a certain amount of money. It gets converted into South African rands, obviously. You can pledge to do a monthly donation if you want to, a small one or a big one or a massive one. And if you're unable to donate, if you could share our social media pages, if you could share our videos. On our social media pages, we try to put testimonial videos. So for example, we get permission from our patients and we record them. Some of them we have to translate. So you might get the original person speaking in Xhosa telling you what their story was. And then you get the translator telling you in English what the story was, the before and after story. So yeah, you can get a really great feel for what we do on the social media pages. The Khula Natural Health Center media page, the one for Khula KZN, or that represents the whole of South Africa, is really amazing. Has some of the most amazing, heart-opening, honestly, it's a place you cannot get away from without actually feeling as if your heart's just been blown wide open. It's the whole African experience it's just heart. I just want to mention one thing in case I forget. Because we want people to feel empowered, and because we don't want them to feel like it is only charity, and because we want them to contribute and to commit to their health, we do charge, but we have a 10 Rand charge, which is less than an Australian dollar, right? So the patients pay 10 Rand, and for that 10 Rand, they get their consultation, they get any investigations that we do, that we check their vitals and check the urine and that kind of stuff, referral letters if they need them, and medication. And that way they feel like it's their clinic. We want the community to know it's their project, that we're not just coming in and, I don't know, our mission is to improve the health of people who have lack of access to healthcare, obviously. It's also to provide employment to our young homeopaths and to give them experience so that we don't lose them. And it is to build and grow communities. Because ultimately, we're looking for healthy communities, because if we have healthy communities, we're going to have a healthy country.
Absolutely. I love that. And because it is an energy exchange as well at the end of the day. So I love that they are contributing something, even if it's once they're healthy, working in like a little veggie garden that you might have there, or like sweeping, or like there needs to be that energy exchange. Otherwise, I feel that you don't get the results that you should. And for the Back a Buddy, I think some people, the rest of the world might know something similar, buy me a coffee, or we've got a few of those types of services. But it sounds like Back a Buddy is a South African type of online donation service. And just for a little bit more context, $1 is 17 South African Rand. I'm just here on xe.com. And €1 is 19 South African Rand. £1 is 23 South African Rand. You can really make a difference in somebody's life by contributing.
If I can contextualize that for you as well, at Khula EC, because we're a small outfit, so you have the 2 doctors, and then we have 3 translators / admin staff. One of our doctors is Xhosa speaking, the Dr. Toka, who comes from Matatiel. Other doctor is not Xhosa speaking, speaks English and Afrikaans. So he needs a translator. So the reason why we have 3 is because we have one person who works in the front, captures the data of the patients and keeps them settled in the waiting kind of area and provides rudimentary health education. We have someone else who will then be in with Dr. Sam, doing the translating. And the third translator, admin person, is a floater who helps out in the dispensary, writing labels and doing that kind of thing. And also, of course, if someone's sick, then we can't only have 2, because if one is sick, then we're in trouble. So we have 3 translators, and then we have a cleaning lady who also does the baking for us if we have any kind of special occasions. So we're like a little family there, and our cost to run, this is now everything. This is utilities, doctors, the building, maintenance, all of that is about, if we're going on a real shoestring, is about 25,000 Rand a month. So again, 25,000 Rand, divide that by 12, it's 2,250 Aussie dollars, which is less US dollars. If you think about it, it's actually a very small amount of money that we need to provide an amazing service that pays both our doctors and our 3 translators and our cleaning lady who does the baking also.
That sounds amazing. Wow. Anything else that you want to tell us about Khula? Are there any sort of like medical equipment that you need there or anything like that? Or remedies or radionics machines or like any other types of things that you need help with?
Okay, so we're limited for space, right? So please don't send us big things. They're not too big, okay? So hospital beds we don't need, but
unless it's payments, big payments,
right?
Not big physical items.
Big payments, yeah. Send us big payments, but certainly. So we operate with the basics, right? We have thermometers and bowmanometers, and we have cholesterol glucometers, and we measure cholesterol and glucose and those kind of things. And we have urine dipsticks. So those are the sort of basic investigations we do. If we had something fancier, we could do fancier tests, right? Obviously. So something in that line would be great, or actually even more glucometers would be great. Or I don't know, if you want to donate a whole box of glucose testing sticks, just bearing in mind though that they expire. So there's only so many of those we can do. But if we get a big donation of something to Khula EC, we can't use all of it. So we distribute. We'll send it to Khula. Khula KZN, they're the guys who can use just about everything. And the turnover of materials is vast. So having said, don't send us big things. They've got more space. You could send us anything. We'll find a way to use it.
Send us useful shit. We'll find something to do with it.
Just send us useful shit, please. That's going to help us actually serve patients better. So whatever you can think of that's going to be great for patients, we could probably use.
Amazing. I love that. And then also, do you take paths from overseas if they were to come and do some work experience in the clinic?
So our Khula EC is a bit small. We've got an extra room, but we're still busy building. So we probably don't have enough turnover of patients, and we're not there often enough. But Khula KZN, definitely. They often have exchange students, particularly from Switzerland. Well, because Manuel and Nicoline, they know them. And Nicoline still does some lecturing at one of the universities. We've had a number of Swiss exchange students come, and definitely open to more. I'm just going to, so because there's certain registration criteria in South Africa, there is a special dispensation that we get from our governing body that allows exchange students to actually work. And at worst, if they cannot specifically see patients, and they can, certainly the ones from Switzerland can, then they can observe and they can assist, which in itself, that sounds like it might be boring if you're already a homeopath and you're like, I just want to get in there. But you know what? When the patient walks out the door, you can get in there and help with the repertorizing, finding the remedy, working in the dispensary. There are education, you know, at Khula KZN. I just want to mention also, I think this is significant. People get taxied in from as far as, I think it's 230 kilometers away. They don't just serve Khula village, right? Because the word of mouth has spread now because they've been there for so long. And people are so desperate for good quality healthcare that they will travel. So what ends up happening is these people get bused in the morning, and then it's first come, first serve. So they've got a big waiting area, and there's usually like a lot of people waiting. And while the people are waiting, someone is offering them education as well. So there's a huge opportunity to basic education about what foods are good for what conditions, and how to, I don't know, grow your veggies better, and what you can do to optimize your immune system, and the importance of exercise. things that you don't need access to first world finances or services to be able to do, and that can make a significant difference to your health. So there's huge opportunity. And then, of course, for exchange, for anyone who wants to come on an exchange, St. Lucia is a major wetland. There are game reserves there where you can see the big five, if that's what you're really after. You can really have, honestly, in KwaZulu-Natal, you can have the whole African experience without ever going to, dare I say it, Cape Town. Because, everyone always wants to go to Cape Town, and Cape Town is lovely. Nothing wrong with Cape Town. And in fact, we'll have a Khula in Cape Town sooner rather than later. But that real African bush kind of experience, KZN is the place to have it.
I was at Cape Town in April this year, and those mountains, it's just nothing like it. So beautiful. Do you happen to use or teach the people how to use agri-homeopathy by any chance?
Actually, no. So they do have a growing project at Khula KZN. We haven't managed to establish anything like that. But to be quite honest, our clinic is next door to a Department of Health clinic, government clinic, which only operates on a Wednesday and a Thursday, only has a nurse, and it's like 8:30 to 2:00. But what these ladies do, their soup kitchen is called Lingaletu. Lingaletu Soup Kitchen they cook soup and they buy bread, and then they feed the people who are in the queues. And so when we opened, they came to me and said, listen, so I said, sure, of course. So we'll help you. So we got them some basic equipment, and we at Khula EC, we sponsor the groceries for that week that we're going to be there. So we buy them the ingredients so that they can feed our patients and they can feed the patients next door. And there's a lot of crossover, actually. So a lot of the patients who go to the Department of Health clinic to get their oral contraceptives or their TB medication or their antihypertensives, they go there, and then when they're done, they come to us for the chronic conditions that aren't being treated or that they don't have medication for example, at the DOH.
Or the side effects of the medication.
Exactly. So it's actually quite symbiotic, right? And we literally our building is what was the garage, and their building was the farmhouse, right? So you imagine how close your garage is to your house, right?
Yeah.
So if not connected. So we've managed to partner with Lingaletu, but there is quite a bit of land available in Necha, in the village where I am, and it's all owned by the tribal council, and the tribal council are very open to us using that for growing vegetables. And so what we need to do, though, is we need to just establish a bit of infrastructure. We have to fence, for example, because the animals roam, right? Goats eat anything. So do cows. Once we are safely running in terms of, I'd say, it's okay, we don't have to worry so much about collecting money to just stay open. We can actually take some of that extra money, and our plan is to actually invest it into fencing and gates so that we can create an enclosed area where we can then get these, especially these older women who are not working, to come in, and the younger people who are not working, to come in and start actually growing. So that's like phase 2, but we just have to survive first.
For now, just survive. Yep. Amazing. Can you run us through the website and all the socials and everything just once again for anyone who was driving while you were talking? Just run us through it all again. I just want to make sure everyone knows how they can get hold of you and how they can contribute.
There is a website. It's called Khula Natural Health. Khula is spelled Khula. So if you just Google Khula Natural Health, you'll find the website.
Just khula.org.
Yeah, I think it's khulanaturalhealthcenter.org. But if you just put in Khula Natural Health, it'll come up.
The website just come up as khula.org, khula.org.
Oh, that's easy. That's even easier.
Khula.org, khula.org.
So that's the website that has the basic info on it. And then our social media pages, there's a Khula Natural Health Center Facebook page. There's a Khula Natural Health Center Eastern Cape, EC, Facebook page. There's a Khula Natural Health Center Limpopo, Facebook page, and the same on Instagram.
And the BackaBuddy, where do we find the BackaBuddy?
If you Google BackaBuddy, and I'll send you the BackaBuddy link.
Okay.
If you Google BackaBuddy and you search for Khula Natural Health.
Okay, I just found backabuddy.co.za. And I'll just use the search box here.
Yeah.
Let's make sure.
But I can send you the link directly.
Send it to me anyway, and we'll put it in the show notes. I found a few. I found Khula Natural Health Eastern Cape, and then there's Khula Natural Health NPC.
Yeah, so NPC is Khula Natural Health, the national body, and then we've got a separate one for Khula.
So you guys are Eastern Cape. Okay, Khula Natural
We're
Health
Eastern Cape. Yeah,
okay,
yeah. We're the ones, the Eastern Cape guys, we're the ones who need the money. Okay. And if you give us too much, we promise we'll give NPC some as well.
Okay, no worries. I can see we've only raised 9% of what you need to raise so far. So come on, everyone. Yeah. While I've got your page up here, I'll just go donate right now.
Oh, thank you.
Wonderful.
That's very kind
It
of
it
you.
does
Thank
it
you.
does feel good, I have to say, when your Aussie dollars is like 12, like you give $100 and it's 1,200 rand. It does make you feel
Amazing.
good.
Amazing. Thank you so much.
Such a pleasure. Thank you so much for coming on today, Loretta. I really appreciate it. And yeah, I really hope our listeners get behind this and you can get out of the Suriname survival phase and into the flourishing, growing gardens, luscious gardens for the whole community and growing food and using agri-homeopathy on it and expanding there. It sounds like you're doing amazing work and hopefully going full-time very quickly so that there could be more homeopaths employed and more people helped and more branches. I think it's going to be amazing. Thank you so much.
Thank you. Thanks once again for the opportunity.